Narcolepsy is a condition that affects the brain and nervous system, making it difficult for people to control when they wake up and fall asleep. Those with narcolepsy often experience extreme sleepiness during the day and may unexpectedly fall asleep during any activity. During a normal sleep cycle, people move through different stages of sleep, including rapid eye movement, REM, sleep. However, individuals with narcolepsy often enter REM sleep very quickly in the cycle, and sometimes even while they are awake. There are two main types of narcolepsy: Type 1, which includes sudden episodes of muscle weakness called cataplexy, and Type 2, which does not involve cataplexy. Unfortunately, many cases of narcolepsy go undiagnosed and therefore untreated, leading to ongoing challenges for those affected by the condition. The symptoms of narcolepsy can take a few months to develop and can last for the rest of your life. The first sign of narcolepsy is usually excessive daytime sleepiness, EDS, which can make it difficult to do everyday activities, even if you've had enough sleep at night. This lack of energy can also make it hard to concentrate, and you may experience memory lapses and feelings of depression or exhaustion. Other symptoms of narcolepsy include cataplexy. This can cause problems ranging from slurred speech to total body collapse, and it's often triggered by intense emotions like surprise, laughter, or anger. Hallucinations. These can occur at any time and are often vivid and frightening. They are mostly visual, but any of the other senses can be involved. If they occur as you're falling asleep, they're called hypnagogic hallucinations, and if they occur when you're waking up, they're called hypnopompic hallucinations. Sleep paralysis. You may be unable to move or speak while falling asleep or waking up, and these episodes usually last a few seconds to several minutes. Disrupted sleep. You might have a hard time staying asleep at night because of things like vivid dreams, breathing problems, or body movements. These are some of the main symptoms of narcolepsy. Narcolepsy comes in two main types, and the type you have depends on whether cataplexy is one of your symptoms. Narcolepsy Type 1. This type includes cataplexy and affects about 20% of people with narcolepsy. Cataplexy can range from mild to severe, causing you to fall to the ground. Narcolepsy Type 2, this type, which 80% of people with narcolepsy have, does not involve cataplexy. It can be harder to diagnose than Type 1. Narcolepsy is a condition that experts are still trying to fully understand. They believe that it may be caused by a combination of factors that affect the brain and disrupt REM sleep. Scientists are making progress in identifying genes that are connected to narcolepsy. These genes control the production of certain brain chemicals that regulate sleep and wake cycles. Some experts believe that narcolepsy could be related to the brain's difficulty in producing a chemical called hypocretin. They have also discovered issues in the parts of the brain responsible for controlling REM sleep. There are certain factors that can increase the risk of developing narcolepsy. It usually starts between the ages of 15 and 25, but it can occur at any age. If there is a family history of narcolepsy, the risk of developing it is significantly higher. It is estimated that about 1 in 2,000 people have narcolepsy, but experts believe that many cases go undiagnosed due to other conditions causing excessive daytime sleepiness. While the condition is thought to affect both males and females equally, some studies have suggested that it may be more common in men and those assigned male at birth. To diagnose narcolepsy, your doctor may conduct a physical exam and review your medical history. They may also ask you to keep a sleep diary to track your symptoms and sleep patterns for a few weeks. Tests for narcolepsy may include polysomnogram, PSG. This overnight test is done in a sleep clinic or lab to monitor your sleep cycle and see if you enter REM sleep at unusual times. Multiple sleep latency test, MSLT. This test measures your tendency to fall asleep during the day and checks for abnormal REM sleep patterns. You'll take several short naps, spaced a few hours apart. Lumbar puncture. This procedure, also known as a spinal tap, is done to check the levels of hypocretin in your spinal fluid. Low levels of hypocretin could indicate narcolepsy. These tests can help your doctor rule out other conditions and determine if you have narcolepsy. Medications for narcolepsy. Your doctor can prescribe the following drugs to treat narcolepsy. Stimulants to help with sleepiness. Antidepressants to address issues with REM sleep. Sodium oxybate, Xyrem, Xywav, to treat cataplexy. pitolisant, Wakix, or solriamfetol, Sunosi, to help you stay awake for longer periods. Alternative treatments for narcolepsy. There's little evidence that any alternative or natural treatment can reduce narcolepsy symptoms. However, some people have found that massage therapy improves their sleep patterns. Additionally, one small study found that meditation relaxation therapy reduced how often people with narcolepsy experienced sleep paralysis. This type of therapy teaches techniques to reassure yourself, shift your focus, and relax your muscles. Always check with your doctor before trying any alternative treatment. Home remedies for narcolepsy. Some lifestyle changes can also help with narcolepsy symptoms. Avoid caffeine, alcohol, and nicotine. Stick to a regular exercise and meal schedule. Eat smaller meals more frequently instead of heavy meals. Manage your sleep schedule by going to bed and waking up at the same time every day. Schedule several short daytime naps, each lasting 10 to 15 minutes. Research into how narcolepsy affects different genders and racial and ethnic groups is limited. However, experts have found that it takes an average of 12 years longer for women to be diagnosed with narcolepsy compared to men. They also note that narcolepsy tends to be underreported in ethnic and racial minorities. One study discovered that Black Americans tend to experience symptoms earlier in life and have more severe daytime sleepiness. This suggests that the condition may manifest differently in Black individuals compared to other groups. Additionally, research has shown that Black people are more likely to have sleep disorders in general, which is believed to contribute to overall health disparities due to the importance of sleep quality for overall health. Living with narcolepsy can impact various aspects of your life, including safety. Having narcolepsy can make everyday activities like driving, cooking, and using machinery dangerous. It's important to be aware of what triggers your episodes of inattentiveness or falling asleep. If you experience cataplexy, it's important to understand what tends to trigger it and talk to your doctor about how to stay safe. Work and school. People with narcolepsy often struggle with staying focused and alert, which can affect their performance at work or in school. Medication and lifestyle changes can help, and accommodations such as a flexible schedule and scheduled nap times might also improve your performance. Relationships and social life. Symptoms of narcolepsy, such as mental fogginess, daytime sleepiness, memory problems, and cataplexy, can make social interactions uncomfortable. It might also be difficult to talk to others about your condition, as many people don't understand it. It can be helpful to communicate with your family and friends about your condition and ask for their support and understanding. Heart health. Untreated narcolepsy has been associated with high cholesterol, high blood pressure, and heart disease. People with narcolepsy often have low levels of the protein hypocretin, which helps lower blood pressure during sleep. Additionally, disrupted sleep can be harmful to heart health. Treating narcolepsy can help manage the condition, but not all symptoms will be eliminated. Lifestyle changes and coping strategies are important as well. Some people find that following a low-carb diet, such as the keto diet, can help with narcolepsy symptoms, but there is limited research to support this. Here are some diet changes that can help. Follow a diet that helps you maintain a healthy weight, as extra weight can affect the quality of your sleep. Eat smaller, more frequent meals during the day to reduce drowsiness, and avoid big meals near bedtime. Reduce processed foods and added sugar, as they can affect your energy levels. Be cautious with alcohol and caffeine, as they can disrupt sleep patterns. Narcolepsy can also have financial impacts, with medical costs being about twice as much as those without the condition. Other extra costs may include lost time or lower pay at work, and expenses due to delays and problems with education. To manage narcolepsy, it's important to be aware of your limitations and help others understand your condition. Here are some techniques to try. Plan your days around the times your symptoms tend to bother you. Be open about your condition with those you interact with at work, school, and socially. Spend time outside or expose yourself to bright light during the day to help keep yourself alert. Tackle long or complicated projects in short bursts and take naps when you start to lose focus. If you feel sleepy while driving, pull over and take a nap. Tell your doctor if you notice any changes in your symptoms or side effects of your medication. People with narcolepsy are at higher risk of mental health issues such as depression, anxiety, and bipolar disorder. Joining a support group for narcolepsy and seeking help from a qualified counselor or therapist can help protect your mental health. Narcolepsy is a long-term condition that can disrupt your daily life, but it is not life-threatening. People with narcolepsy may find it difficult to do certain activities, such as swimming or driving, as they could pose a danger. Unfortunately, there is currently no cure for narcolepsy, but most individuals do experience improvements with treatment. While narcolepsy symptoms may not worsen over time, they may also never completely go away. Treatment can help manage the symptoms, and individuals can also learn ways to adapt to living with narcolepsy. Since the cause of narcolepsy is unknown and it can occur unexpectedly, there is no known way to prevent it. Some related problems that people with narcolepsy may experience include periodic limb movement disorder, PLMD. This is when your leg muscles move without your control many times during the night. Sleep apnea. This is when your breathing often stops and starts while you sleep. Automatic behavior. This is when you fall asleep during a regular activity like driving, walking, or talking. You continue the activity while asleep and wake up with no memory of what you did. It's important to note that many other conditions can cause symptoms similar to those of narcolepsy, which can make it difficult to diagnose. Other sleep disorders like insomnia and sleep apnea, as well as mental health conditions such as depression, can also cause daytime sleepiness. Narcolepsy can also be mistaken for epilepsy or substance use disorder. There's also a similar condition called idiopathic hypersomnolence, IH, which also leads to sleepiness during the day. However, unlike those with narcolepsy, people with IH tend to sleep for long periods, often 10 to 11 hours at a time, and have a very hard time waking up. Narcolepsy is a chronic condition that can have a big impact on your daily life. With the right treatment and lifestyle adjustments, you can manage your symptoms and make things easier for yourself. It's important to recognize your limitations and make changes to your daily routine to accommodate them.